Welcome back to West New York Living. Now, spring officially starts March 20th this year, and if you're wondering, summer on June 20th. Now, why am I telling you these dates? Well, if you're looking to shed a few pounds between spring and summer, you've got 3 months to do so. Now, if you need a little help to get started, my next guest can help. Pleasure to have back here on the show, Donna Herberger from the IDLU Weight Loss Center. Donna, good to see you again.
Good to see you, Kevin.
You've helped thousands, and I'm not exaggerating that number.
No.
Thousands here in Western New York. Make the change they need and help them with the change. How do you do it?
It's a structured program. It's a scientific approach to weight loss. All of my coaches are certified. The food that they eat from us is a higher protein, 15 to 20 grams of protein per serving. It's very absorbable, great, high quality protein, and they're accountable. They have to come in every week, get on the scale, meet with a coach, and the combination of all those things, it just works.
We're going to talk more about coaching in a second, but there are some terms that people need to be familiar with. BMI versus BMR versus visceral fat.
Okay, so your BMI is, if you look at a BMI chart, where your height and your weight intersect, that's a healthy BMI. Healthy BMI would be between 18 and 24.9. Then we go into an overweight category, an obese category, and then morbidly obese. The higher the BMI, the more dangerous. We also look at someone's waist size. A woman's waist size, without clothes, should be 35 inches or less, and a man's waist size should be 40 inches or less, because that's a direct correlation to their visceral fat. Visceral fat is a number that everyone has. It's not the inch you can pinch, it's not the muffin top, it's deep inside, and it's around our organs. So a high visceral fat number is linked to a higher increase of having a heart attack, stroke, and even certain cancers. Your BMR is your basal metabolic rate, and that reflects if you were doing nothing for 24 hours, literally laying in bed with no activity, how many calories would your body burn just by you breathing, bodily functions, just by existing? The more muscle you have, the higher your BMR. So you want a high BMR, and that's why men usually lose weight faster than women. They have more muscle. Women by nature have more fat. The more muscle a person has, men or women, the higher the BMR, the higher the metabolism, the more calories they're going to burn. So we want to preserve muscle while they're losing weight. Lose the fat, preserve the muscle.
And that's what the protocol helps with, and coaching, virtual coaching.
Yes.
So no matter where you are, you can be coached.
Allegheny, Cattaraugus, Chautauqua, Genesee, Orleans, Wyoming, Potter, and McKean. So we target those counties specifically because they're still within Western New York. Those are people that might be watching this show, and we can reach them and do it virtually, like Sarah and Melissa, who you're seeing in this brief video. Erie and Niagara County, we want folks to come in because they will do a little bit better with the one-on-one, face-to-face.
Sure. Speaking of one-on-one, face-to-face, you had a chance to talk to a doctor. We're going to watch that on the benefits of losing weight.
Yes. Thank you, Dr. Stephen Racina, for joining us today to talk about orthopedic issues. What are the short-term and long-term effects of someone carrying excess weight with their joints?
Most commonly, the short-term effects would be a reduced mobility of the person and an ability to do their activities of daily living. The long-term effects, one will find, is the production of premature degenerative arthritis in the joints, producing pain, loss of motion, limited activities, and need for initially conservative treatment followed by aggressive treatment, including surgery when the conservative measures fail.
What are some of the conservative treatments that they could do to help alleviate some of that pain?
Weight loss is one of the best things to reduce the issues and lower the incidence of pain and discomfort. I can recall many people in my practice who just would lose 30 pounds or 40 pounds with no medical care and treatment, and their aches and pains would go away.
When someone has a higher BMI, they're in the overweight or obese category, are there higher risks and complications when they have surgery?
We're seeing it more and more now where insurance companies, you have a certain BMI or body mass index of like 40 or more, they will not allow you to have the surgery because of the risks and the complications being markedly elevated when you're overweight. singular most important thing a person can do is to keep their weight down and keep it in a normal, healthy range.
I'd like to thank you for joining us today, Dr. Stephen Racina. We really appreciate your time.
All right, if that's not motivation enough to get to a doctor telling you, yeah, all the effects too on joints as you age, and you know, if you need a surgery and you can't get it, that's got to be horrible.
Right. Insurance companies want to have a lower BMI because you're going to have less risk and complications, less risk of infection, and if you're having a total joint, those joints are going to last longer because you're not stressing them out.
All right, we're going to tell everybody how they can get started with the Ideal You Weight Loss Center, your healthy, rapid weight loss center. They can successfully help you reach your weight loss goals in 2025 and, most importantly, keep the weight off. They have 3 locations in our area, and you can register for an upcoming virtual or in-person open house. And to find out more about their weight loss program, head to their website, idealu.com.